Patients and specialists are calling for the government to make cuts to specialist costs following an $8.5 billion funding boost to Medicare. Consumer groups say specialists' appointments deliver a bigger blow to patients' pockets than GP appointments, with costs continuing to rise. Elizabeth Deveny is CEO of the Consumer Health Forum of Australia, and she joins us now from our Melbourne studio. Elizabeth, very good morning to you. How much of an issue is this, the cost of specialist care?
It's a very significant issue. For some people, a lot of their healthcare is delivered by specialists rather than GPs or others, and so the costs for them can be significant.
What services are we talking about, Elizabeth?
So it might be dermatologist, a paediatrician, an obstetrician, an ophthalmologist, all of those ologists, people that deliver services that aren't GP services.
And so how does any rebate worked within the system work at the moment?
So at the moment, if you go to see a specialist, your Medicare rebate is about $84 for the first appointment and $42 for the subsequent appointments. And what people are telling us is that's nowhere near what the cost was that they paid out of pocket.
And I think you touched on it before, but so bulk billing for specialists is incredibly low compared to GPs, is that right?
Yes, that's right. The rate of bulk billing in general practice is much higher than it is in specialists' environments.
So many organisations calling on the government to introduce something different, something that helps these people. What?
So there are things we could do to start with the current Medicare safety net. So there's a safety net that when you've spent over a certain amount of money in a year, it's about $2,500 for the average family, the government will start paying more of your out-of-pocket costs. But in order to do that, your family needs to know this is a thing and register for it and say, these are our family members and we would like to be put on the list for the enhanced Medicare safety net. We think it'd be great if the government was more proactive in telling people about these services and helping them register. And there are other services that governments offer that can also help reduce the cost of your care, like the Medicare and also the PBS or the pharmaceutical benefit scheme safety nets. So the more we can do to make sure that everyone knows what these taxpayer benefits are and how they can access them, the more we can help people reduce their costs.
And I guess the bottom line is if Medicare is used for GPs' practices, more people, like the argument goes, would be visiting their GP in the early signs of any potential illness, which could reduce the need for specialists down the line. Is that right?
Absolutely. So we say, you know, it's better not to be sick. Everyone knows prevention is better than the cure. So if people can see their local primary care clinicians, their GP, the practice nurse, physio, whoever it is, and get early identification of an issue and it's dealt with, sometimes that can really change the trajectory of their healthcare journey. It won't always though, so we also need to make sure that when it's a non-GP specialist that you need to see, that care is also affordable and easy to access.
And so these Medicare safety nets and the other things that are in place that you mentioned, is the uptake of them very good or not?
Well, I think it's pretty patchy. When I'm talking to Australians, often people don't know about these services or they assume if they're available something, it will be automatic and the government will tell them. They don't understand that they need to fill out a form or make a phone call or note something. We'd like to see more and more these things are automated and the government proactively says to citizens, hey, there's a service here you might qualify for, would you like to put your name down?
OK, so as you'll know, the Health Minister, Mark Butler, has said yes to any potential increase, but that savings on specialist rebates should flow through to patients. Has it been the case that that hasn't necessarily happened in the past?
So the rebate is your rebate. So if you go and see a doctor or some other health professional, the money comes to you. That's separate to what you might be charged. And so I think there is a general concern that if the government increases the rebate, that you might also see the cost increase. So overall, in your pocket, there's no change. So we really want to know when any rebate is increased, that the cost of care is not also increased by the same amount.
Coming up to a federal election, as you know, health is always a hot political potato. What would you ask of all the parties?
Well, we're really hoping that the 48th Parliament will listen to what Australians are saying, which is they can't afford to be sick. And if they're sick, they can't afford to get well. And in a country like Australia, we need to do better. We need to make sure that benefits that are available to Australians are available equally, and that we work collectively with communities to understand what the biggest issues are, and then we provide them with the support they need to be healthy. It's good for the individual, for their family, for the community, and of course for the country, because we'll be a more productive, happier and healthier Australia if people can get the health care they need.
Elizabeth Deveny from the Consumer Health Forum of Australia, thank you very much.
Thank you, Lorna.